All right, here's the deal. All disease is a breakdown in terrain, and terrain breaks down from a deficiency of electricity. When you understand that, you start seeing disease for what it really is, a loss of voltage that can be measured, mapped, and corrected directly from the ear. In this training, I'm going to show you exactly how to identify electrical collapse in organs, channels, and tissues straight from the ear. Use auricular mapping to detect voltage deficiencies before chronic disease sets in, and understand why the ear connects not just to the body and brain, but to emotion and even consciousness itself. I'm Dr. Jeremy Steiner, and this is the system of electro acupuncture and terrain medicine I teach to help practitioners get real, reproducible results. You'll see how a drop below minus 20.8 millivolts in any channel, nerve, or tissue shows up as visible or measurable changes on the ear, and how to read those changes before they turn into chronic disease. If you haven't subscribed yet, hit that button now so you don't miss any future trainings. And be sure to download the free Auricular Diagnostic and Treatment guide that comes with this video. It's your step-by-step reference for applying everything you're about to learn. All right, let's dive in.
All right, so as we do with all things in this system of electric medicine, we start with the principle that all disease is a breakdown in terrain, and terrain breaks down from a deficiency of electricity. Then we can move on to see that disease can be measured as electrical deficiencies in all the different terrains of the body, such as the channels, the nerves, the tissues, and more. Now, in the acu channels and the blood and the earth, we want to see minus 20.8 millivolts. When a disease process occurs, it saps up this electricity so that this minus 20.8 millivolts in cells and acuchannels decreases to less than that. That's when chronic disease appears. Well, all of these deficiencies can be diagnosed and treated directly from the ear. It's pretty cool. Let me show you what I mean. Now, the ear is one of my favorite ways to diagnose and treat. And why is that? That's because there's a connection between the ear and the body and the brain and the mind and the emotions and existence that exists outside of the nervous system. What do I mean by that? Well, let's have a little example here. I could choose any organ, but let's go with the liver. And in this green circle is the liver area on the right ear. Now, why did I choose right ear? Because the liver organ is only on the right side of the body, right? So when the liver organ is diseased, let's say we have a patient that is a chronic alcoholic abuser, it saps up and damages the cells of the liver organ. Well, that is a cheese stealer, to be put simply, right? That alcohol is a chi stealer. It's stealing chi directly from the cells of the liver. They're getting damaged. They no longer have enough voltage, minus 20.8 millivolts or greater, to function. When that liver organ has decreased electricity, decreased voltage, that's when the disease starts. Well, when that organ has decreased voltage, that organ on the ear also has decreased voltage, which makes it a great place to use something like a point finder, like a point-o-select, which is measuring electrical resistance, running it through formulas to really find where the electricity is deficient. But not only is it a great place to diagnose, meaning the ear as a window to the body, but it's a great place to treat as well. Electricity is the best medicine. So once you find the deficient point, which is the deficiency in the organ, you can feed electrons into, or electricity into, that deficient spot. Now, when you feed and raise the voltage, let's say you use your point finder. Now, you could do this with a probe also, because a decrease in voltage creates an Ashi point, which you can feel and find with an ear probe. I still prefer a point-o-select or an ear finder because it gives me readings of deficiency. Let's say where this little X is where I have found a deficiency. That means the anatomical location of this X here is deficient, is the anatomical location in the liver organ is deficient as well. And if I insert electricity here, that electricity will fill up the liver organ directly. And there is no nerve that connects this liver ear area to the liver organ. Isn't that cool? So not only do organs show up, But you can see here a lot more. Neural levels show up, like these spinal neural levels here. Tissues show up, and I bunch the organs under the heading tissue. But we have a bunch of different tissues. We have brain tissue, don't we? We have blood as a tissue, so on and so forth. The acuchannels show up on the ear as well, and the acuchannels are not the same thing as the nervous system. If you've been studying with me for a while, you know this. The acuchannel system and the nervous system are two different distinct things. We can address both with electroacupuncture, but it's important to know that they're two different things, and the channel system is really a power supply. So the stomach channel, which is made up of muscle battery packs, and the wiring system is fascia, feeds electricity, supposed to be minus 20.8 millivolts or greater, into every tissue and organ fed by the stomach channel. Well, these channels show up as deficient on the ear. Isn't that cool? Channels are on the ear. And we also have brain receptor points. This is the left ear Valium point. How cool is that? A benzodiazepine receptor point on the ear. If you want to stimulate the Valium point and get some of the effects that a benzodiazepine might have, you can possibly do that if it's deficient. I recommend. Now, what am I showing you here? I urge people who study with me, and I do in my own clinic, I only choose 4 points that I've diagnosed in this setup here. You can look for a neural level, you can look for a tissue level, that's 2 points, you can look for a channel that's deficient, all on the ear, and you can look for a receptor, that's 4, and I only use 4 needles in my clinic. Now, so let me tell you a little more. So acute disease and chronic disease show up a little bit differently on the ear. What do I mean by that? Well, let's do an example. Let's say somebody has a car accident and they damage the C2 vertebrae, which is right here, right? Well, immediately that damaged vertebrae is going to be starving for electricity, and it's going to show up on the ear electrically, okay? But then if that deficiency doesn't go away and it stays there long enough, it turns chronic, and you can see this as tissue changes on the ear, maybe blood vessels, maybe blemishes. I'll show you a little more in a second. But I'm about to go over an example of the sciatic nerve, which comes out from the T10 through L2 area, maybe L3 area, which is this area here. So deficiency in that spinal neural level, which feeds this area of the tissue here, and it's gone on chronic, will show up as tissue changes on the ear, either in this area or wherever there's tissue changes. Let me show you what I mean. Because once disease gets chronic, you can literally see it on the ear. Remember I showed you that brain receptor point, the Valium point. Well, here is a study done during COVID. The patients on the left here, this was done in a hospital. It's called interferon point alteration in hospitalized patient with COVID-19. This is the interferon point in this black circle here. And it's a receptor point that's related to the immune system. And as you can see, these 3 patients do not have COVID, and there's nothing remarkable about the interferon point in these 3 patients, right? Then these 3 patients do have COVID, and each one, you can see this interferon point is inflamed. It's edematous. That's the tissue changes I was talking about. So by visual inspection, you can see the deficient areas that are chronic, and then take your point finder or an ear probe to really hone in on the deficient point that you wish to treat. But it's not only brain receptor points. We are back to 2 different sciatic patients. We said the sciatic nerve coming out of the spine in this area here, feeding the tissues here, right? If you remember, the knee points right where this X is, I know that L1, L2 spinal nerves, which come out of here, feed the knee. And look at these vessels here. By visual inspection, you know this patient has a problem in this area. Here's a different patient, another sciatic patient that is here. Now, on an upcoming slide, I'm going to show you what's this. Ooh, that's a blemish. But where is that blemish? Around T1. Why am I telling you this? Keep that in the back of your head for a upcoming slide soon. So chronic disease also shows up on the channels. Here you have the stomach channel representation on this ear here. And look, chronic issue in the stomach channel showing up here. Chronic issue in the stomach channel is a different patient showing up here. Now let's go over a little example. You have a back and leg pain patient, right? And they come in and you're like doing your normal thing, and like a lot of people would think, oh, kidney chief acuity, right? Well, if you're looking at the ear, and this is what I meant by look at this blemish on T1 here, well, what organ is fed by T1? You might recall, if you've taken my classes, that it's the thyroid. So this back pain patient wasn't just a simple back pain patient. They actually have hypothyroid, which I didn't tell you about. I love to use this point finder because I quickly scan for blemishes. I put my point to select here. When this number drops below 8, that shows me it's deficient and I treat it. This is what it looks like here, down here, when you're scanning and treating, right? So this back pain hypothyroid patient, this is an example of 4 points that I can locate and treat based upon visual inspection and based upon taking readings electronically. So one of my points would have been that L2 neural level if it showed on the point to select. Remember, this is just an example that I made up, but it's very common and very likely to happen. One of my points would be around here in that blemish area, as long as my point to select verified or my pressure probe verified. The gallbladder channel probably would have showed up deficient on this patient, and this is where gallbladder 1 is here. And then this Valium point indicating a deficiency in the benzoreceptors. Basically, this patient needs to chill out, right? Let's do one more example so that you can gain clarity from this. So a knee pain patient comes in, her knees look like this, she's had bilateral replacements, and she does not tell you about her breast cancer. Not to worry, because we don't rely on patients. Patients lie all the time, don't they? This is what breast cancer looks like on the ear. And you're like, well, Jeremy, what do you mean? How does breast cancer show up here? Well, look, isn't this a chronic tissue change, right? Well, this is the breast area of the ear. Now, let's say this is early breast cancer and it's like under 6 weeks, so it hasn't shown up on the ear. You can still detect this breast cancer with electronically, because remember, acute disease appears as deficient electricity before there's tissue changes on the ear. And this is the example of the 4 points that we would have found. The T4 neural level, the breast tissue here. Now remember, the T4 neural level feeds the breast tissue, doesn't it? And when the neural level is deficient, it's failing to feed electricity into the breast tissue, or vice versa. The breast tissue is deficient and it's sapping energy from the T4 spinal level. So those are 2 points we could potentially treat for this knee pain breast cancer patient. If you've taken any classes from me, you know all breast cancer is a stomach spleen channel deficiency. This point on the stomach channel is likely to show up deficient. Actually, any point on the stomach channel would likely show up deficient. If you're going to treat a channel, try to choose a point early on the channel. And then the interferon point, which I showed you before, which is related to the immune system.
That's how you start reading the body's electrical map right from the ear. When you understand that all disease is a breakdown in terrain, and terrain breaks down from a deficiency of electricity, everything you see on the ear starts to make sense. Remember, the goal isn't to guess where disease is hiding. It's to measure where voltage has dropped and restore it. That's the foundation of true electroacupuncture and terrain-based medicine. If you got value from this training, download the free Auricular Diagnostic and Treatment Guide right now. It's packed with valuable information you can use immediately. And if you want to go deeper into further trainings, classes, and possibly mentorship, visit electroacupunctureinstitute.com for upcoming opportunities. Stop guessing. Start reading the body's real diagnostic map. I'll see you in the next training.